Hello, my name is Charlotte McArdle and I'm Deputy Chief Nursing Officer with responsibility for safety and improvement at NHS England, and I'm delighted to be supporting this four-nation approach to raise the profile of pressure ulcer prevention on International Stop the Pressure Day. Pressure ulcers can have a major impact on patients and those caring for them, as well as the pain and suffering it causes to patients. Caring for patients who develop pressure ulcers costs the NHS in the region of 531 million per year. Pressure ulcers also can happen to anyone, from tiny premature babies to those at end of life, and they occur in both physical and mental health settings, and may even happen to a person who's been otherwise healthy but has had a short period of enforced immobility due to planned surgery or even an epidural during labour. The main way we can reduce this significant harm to patients is to recognise those that are most at risk and to put in place appropriate prevention actions. And being able to identify what factors place a person at risk of developing a pressure ulcer is a fundamental part of clinical care. And we know that immobility, poor blood supply, poor nutrition, lack of sensation, and the use of any medical device that has contact with the skin, and the presence of a previous or existing pressure ulcer can significantly increase an individual's risk when a person is in NHS care. And these factors need to be assessed from both an assessment when the patient arrives, but also at regular intervals, and particularly if there's any change to the person's overall condition or indeed their care setting. So while we know there are common risk factors, person-centred risk assessment is key in the prevention of pressure ulcers. A person-centred risk assessment helps the person and the professional to recognise when there's an increased risk of developing a pressure damaged area, and will inform the development of an individual care plan. Some people may have chronic long-term conditions and be cared for by their family or informal carers, and they may too develop a pressure ulcer because they come into contact with a healthcare professional. So we also need to raise the profile of pressure ulcer prevention and risk factors with social carers and the general public, so that they are aware of the risks and they know when to escalate and raise their concerns to a healthcare professional. So recognising risk for every person in our care helps us to prevent harm occurring to our patients, but also ensures that we make the best use of very scarce resources.
Hello everyone, my name is Lynn Woolsey and I'm the Deputy Chief Nursing Officer for Northern Ireland. As Deputy CNO, I am delighted to lend my support to this Four Nations approach to the Stop the Pressure campaign. Recognising the person's individual risk factors is the first step in preventing pressure ulcers occurring, but it is the response to the risk that prevents the pressure ulcer occurring. Once risk factors are identified, the healthcare professional has a responsibility to respond to that risk and implement a person-centred care plan to prevent the pressure ulceration. This plan of care should consider risk factors and deliver care that, where possible, removes or reduces the specific risks. Typically, this care is delivered in a bundle approach focusing on skin. S is for skin assessment and care, looking for existing damage and identifying any areas of high risk. S is also for surface selection and use, which should consider the patient's daily routine. K is for keeping the person moving, supporting their return to independence, or ensuring that a relevant repositioning regimen is implemented. I is for increased moisture control, and N is for nutrition, which also includes the assessment and management of hydration. When developing the response to the risk factors, it is vital to think how other members of the interdisciplinary team may contribute to the assessment, response, and care. The response to risk must consider the patient's wishes and capabilities and be appropriate for the environment of care, with the person and their family offered the opportunity to participate in that care if it is appropriate.
Hello, my name is Richard Desir. As Nursing Officer for Patient Experience, Quality and Patient Safety for Wales, I am delighted to lend my support to this Four Nations approach to the Stop the Pressure campaign, which focuses on the importance of risk assessment in the prevention of pressure ulcers. Once risk has been recognised and responded to, it is important that this and any pressure ulcer that occurs is recorded and reported into the appropriate clinical records and safety management system. Recording pressure ulcers within the clinical documentation both ensures that we have a record of the event and that we have a place to communicate with clinical colleagues what is happening and what is planned. The clinical record also serves as a place to plan when a reassessment is due and to record the ongoing recognition of risk should the situation change. Where possible, the systems for doing this should be standardised across organisations, and all healthcare professionals completing the documentation should understand the importance of using the correct clinical terminology within the records. And this helps us to understand not only what has happened for each individual patient, but also the bigger picture across the organisation, the healthcare system, or even across the country. If we can use a standardised tool in our recording, this can also help our healthcare professionals who work across other organisations. Now, the NHS in Wales is really proud to be the first nation in the UK to have successfully implemented Purpose T across both primary and secondary care. This demonstrates the collective strength of the All Wales Tissue Viability Nurse Forum in making positive change, impacting patient care, and aiming for zero tolerance in the development of pressure damage. We should also consider when recording how we engage with the person and their family, carers, as part of the duty of candour if a pressure ulcer has occurred. Recording can also be important for patients as a way of ensuring the person understands their role in their own care and how they and/or their family and carers can contribute to reducing their own risk and why the healthcare professionals are doing the things that they do. Recording could be in many formats. It can be an individualised patient record, a pressure ulcer passport, or the use of digital systems. And this would very much depend upon which is the most relevant for the patient, carer or guardian.
Hello, my name is McMahon. As the Chief Nursing Officer in Scotland, I'm delighted to lend my support to this Four Nations approach to Stop the Pressure campaign, which focuses on the importance of risk assessment in the prevention of pressure ulcers. Irrespective of the care environment in which you work, I would remind you to consider the elements discussed by my colleagues in relation to your practice. Recognise, respond, report and reassess. Recognise when a person is at risk of developing pressure ulceration. Respond to that risk and implement a person-centred care plan to prevent pressure ulceration. Record and report any incident of pressure ulceration using your own organisational reporting system. And reassess risk when there are changes to the person's circumstances, whether that be environmental or health related. Person-centred risk assessment is key in the prevention of pressure ulcers. A person-centred risk assessment helps the person and the professional recognise when there is an increased risk of developing pressure damage and will inform the development of an individualised care plan. To prevent pressure ulcers in any person at risk, it is essential to respond to the risk assessment and implement a person-centred care plan. This person-centred care plan will detail the management of the risk and include robust preventative strategies, support and information for the person and/or their carer. Effective care planning involves input from the multidisciplinary team, and information provided should be responsive to the individual's needs. Should a pressure ulcer injury occur, the risk assessment will include a wound management plan, a person-centred care plan to prevent the deterioration of the pressure ulcer. Please also remember to report the pressure ulcer using your own organisation's reporting system so that pressure ulcers, incidents and trends can be monitored and targeted improvement work implemented. The person-centred care plan will also outline when to reassess risk and in what circumstances. Accurate and clear documentation, which includes the use of standardised assessment tools, will ensure a joined-up care for the individual across care settings and professional groups. Timely and appropriate communication between the person, social care and health staff will promote person-centredness and collaboration to achieve the best possible outcome for the individual. To recap, when thinking about pressure ulcer prevention, don't forget the 4 R's: recognise, respond, record and reassess.